Thank you very much, Chair. And good evening, faithful audience. You're still here. Well, it's quite late, and I hope you are all still fit and well awake. I will not have slides, so you'll have to look at me. Maybe that helps also to stay awake, because it must be tiring to listen to so many long talks. So it's an honor to talk to you today about migration, migrants, and sexual reproductive health. Speaking on behalf of the UN Migration Agency, IOM, first a few words on migration. There are some 258 million international migrants, half of them are women, some 20 million refugees, and some 28 million internally displaced persons. So the numbers are big. Recently, the Secretary General said the mega trends in the world today include climate change, urbanization, and migration. And migration actually be part of the former two as well. So it's an important topic to talk about. So why do we need to talk about migration and migrant health? First of all, migrants are human beings, and they have a right to health, including sexual and reproductive health. However, that sounds very easy, but many don't see their rights materialize, especially those without proper papers, the sans-papiers, the undocumented, the irregular migrants, and so on. Including migrants in health systems improves public health outcomes. There is no public health without migrant health. The example of disease spread is a very good one here. Thirdly, healthy migrants contribute to positive development outcomes. Interestingly, high costs are often referred to as the main reason to not include the health of migrants in health systems. Meanwhile, research quite overwhelmingly teaches us, though, that migrants contribute more in taxes and GDP of both host and home communities than they use in benefits. IOM always says that migration is a health determinant. Now, what do we really mean with that? The circumstances in which migrants travel and the conditions they face in countries of origin, transit, destination, and return increases their vulnerability to ill health, and that's especially the case of sexual reproductive health. Think of legal barriers to access health services. Think of exploitation and abuse, poor working and living conditions of many migrant workers, such as caregivers, minors, detention practices, or upon return, the introduction of diseases acquired abroad when they go back to home communities. I want to quote an example of a recent IOM study on the health-related impacts of high mobility in remote communities in the Solomon Islands. When asked migrants about the main migration-related impacts in their new communities, the majority of respondents said transsexual and exploitative sexual relationships. That's very alarming. Some key challenges for health systems, especially those in situations of crisis and fragile states, are the inadequate health system capacity, the resilience and ability to respond to crises and emergencies because of the overwhelming burden and needs. In addition, given the high number of cross-border movements and the lack of continuity of care for migrants who move between health systems are of great concern. That's especially the case for treatment of long-term conditions such as HIV. When people cross borders, they connect health systems. On health monitoring side, many countries have limited health information systems which lack data on migrants, and this reduces, of course, the capacity to develop so-called evidence-informed policies. And then, of course, the healthcare financing. Migrants are disproportionately affected by out-of-pocket payment and lack social protection and health, or the portability thereof. So we're therefore very pleased that the ICPD Plan of Action includes numerous explicit actions and principles dedicated to migrants and displaced. Now, my last part, the organizers had asked me to elaborate on examples of IOM addressing sexual reproductive health to achieve SDGs. Indeed, among our over 200 ongoing health projects in the world, many focus on sexual reproductive health and to include it in comprehensive primary health care. Allow me to emphasize that we are working actually with many of the countries here in the room. And there are examples on all continents, but of course I can only underline a very few in the few minutes I have. For example, in Bangladesh, just in 1 year, IIM's medical teams provided access to primary and reproductive health care services to well over 130,000 undocumented Myanmar nationals and some over 500,000 host community members in combination with mental health and psychosocial support. In Southern Africa, since 2016, IIM and partners implement the Sexual and Reproductive Health and HIV Knows No Borders Consortium to implement a regional project to improve sexual and reproductive health and HIV-related outcomes amongst migrants. This is a collective effort that's implemented in 6 countries in the Southern African region. Middle East, closer to home, Tunis. The Challenging Operating Environments policy of the Global Fund offers an innovative financing mechanism for a multi-country initiative in the Middle East to deliver prevention and treatment services for HIV, malaria and TB as well, to migrant populations. Again, in this area of the world. Since 2018, IIM has collaborated with the Tunisia Board for Family and Population to implement a regional project to enhance access to sexual reproductive health and rights services for migrants transiting through Morocco, Tunisia, Egypt, Yemen, and Libya. As a final example of pure SSC, IOM Morocco and Thailand held a cross-regional workshop in June this year between representatives from ministries of health, migration, labor, WHO, civil society from the MENA and the Asia-Pacific region to exchange best practices on migration-sensitive policies to promote health rights. One common challenge of both regions is the difficulty in capturing data for all migrants, especially the undocumented migrants. As a result, IOM will begin mapping migration health profiles in the 5 countries here in this region that are part of this project. The big take-home message about the practices of which I only gave you a little glimpse is that migrants connect countries and communities, regions and sectors when migrating. Multidisciplinary and multi-country approaches are essential. The health sector alone will not solve this matter. Lastly, why is this topic so important, and why is this timing so important? Well, because now we see major policy developments in 3 very important domains. 1, the migration domain, the migration agenda. The New York Declaration for Refugees and Migrants in 2016 and the Global Compact for Safe, Orderly and Regular Migration, or the GCM, of 2018, which was adopted by the majority of countries in the world. As a secretariat and coordinator of the newly established UN Network on Migration, IOM is dedicated to support member states in the implementation of the health-related commitments of the GCM, which also address sexual and gender-based violence and migrant women health. On the global health side, IOM closely collaborates with WHO in meeting the commitments of the Global Action Plan on Promoting the Health of Refugees and Migrants, which went through the latest World Health Assembly. This plan, this GAP, the Global Action Plan, is also part of the GCM and extensively discusses sexual and reproductive health. Now, on the development, thirdly, the development side in the SDGs, as we know, sexual reproductive health, as well as migration, cut across a whole range of different goals and targets. But moreover, and in closing, at the end of this month, the UN General Assembly will talk about the political declaration of universal health coverage at the end of September. So we need to use this unique opportunity, this unique political outlet, to ensure that sexual reproductive health and the health of migrants in general is accounted for and acknowledged in an integrated part, as an integrated part of development in our increasingly diverse societies. Not doing so will mean universal health coverage is not about universality. I look forward to seeing you in New York in a few weeks and welcome you at a dedicated side event on migration health on 25 September, co-organized by various member states and IOM and WHO. Leave no migrant behind. Thank you very much. Look forward to your questions.